Imagine walking into a hospital where nurses are afraid to ask for help, new staff members are resigning due to being publicly humiliated, medical errors are happening, and infection rates are rising, all during the same shift every single night. And on top of that, Cofebris will also arrive in a couple days to evaluate the hospital. This is the current reality of the night shift of Floor 3 at Hospital General Regional number 17 in Cancun. What started as interpersonal tension has now developed into a full-blown leadership and patient safety crisis, which not only threatens the hospital's performance, but also its reputation, stability, and regulatory compliance. Let's analyze it. The hospital is currently failing in several critical performance indicators. Patient discharge rates are below target, catheter-related bloodstream infections have more than doubled, medication documentation errors are increasing, and the nurse turnover at the night shift has reached 14%. Now, after analyzing the situation using the toxic triangle framework, it has become clear that the main source of toxicity in the environment is Leticia, also known as Leti Vasquez, the night shift charge nurse. Now, although Leti is clinically experienced, her leadership style has quickly become authoritarian and emotionally harmful for others. Multiple nurses have reported yelling, intimidation, and public humiliation. For example, Brenda Sanchez, a new graduate nurse, resigned after describing constant public humiliation by her supervisor. Furthermore, Daniela Torres, the qualitylation nurse, repeatedly tried to improve patient safety systems and electronic medical records, but her efforts were ultimately ignored and even criticized. The toxic environment not only affected the staff, but also patient care. Camera footage shows Brenda requesting help to place a catheter, while Leti completely ignored her. In addition, badge records and medical chart changes created concerns regarding the narcotics and accountability before the Cofebris inspection. However, we cannot only blame one person. Weak supervision during night shift, chronic nurse shortages, overtime, as well as KPI pressure and the tension between the management and the union created a permissive environment where toxic behavior such as Leti's continued without any repercussions. The result is a workplace where nurses feel emotionally drained, communication is completely broken down, and the safety of the patient is in dire risk.
This crisis, we developed an intervention plan using the full-range leadership model, which basically combines the immediate corrective actions with the long-term cultural change. So first, in the short term, immediate stabilization is necessary before the Cofebris infection. So we recommend temporarily removing Leti from any charge responsibilities while the investigation is being done. The hospital should also focus on increasing night shift supervision, audit narcotics handling, and medication records. They should also reinforce infection control and EMR training while also holding confidential listening sessions with nursing staff to restore psychological safety within the environment. These actions that I just mentioned are transactional leadership because immediate accountability and rapid correction are necessary to avoid and reduce operational risk. Second, in the medium term, the hospital must build trust and teamwork. This includes creating mentorship programs for new nurses, implementing respectful workplaces, and anti-bullying training, improving interdisciplinary communication in meetings, and also establishing anonymous reporting systems so the staff feel safe enough to report concerns early. These strategies focus on transformational leadership by improving collaboration, motivation, and emotional support. Finally, in the long term, the organization must create sustainable cultural change. So what we recommend is leadership development programs for charge nurses, wellness and burnout prevention initiatives, and shared governance councils and regular psychological safety assessments. Leadership evaluation should also include the staff feedback to strengthen the accountability and emotional intelligence within nursing leadership. They have to remember that the goal is not only to solve the current crisis, but also to prevent future toxic leadership situations from developing again within the hospital.
Okay, so question. In this particular case, we're looking at immediate intervention. This situation is no longer a workplace disagreement. It's more about affecting patient safety, staff well-being, and also hospital performance, as well as regulatory compliance before the upcoming Cofebris inspection. If this leadership does not intervene quickly, the hospital risks to get more infection. Additionally, nurse resignations, lacking from the staff as well, union escalation, and possible sanctions coming from the inspection of the Cofebris, and some other important contributing factors such as bad social media exposure because of the bad performance of the hospital. So what we're requesting is basically an immediate administrative support to implement an intervention plan to strengthen the night shift, also to supervise, investigate the bullying and medication management concerns within the hospital. And with this strategy, we're trying to rebuild the trust within the nursing team. Acting in this way can help us to stabilize the environment and show the staff that patient safety and also respectful leadership are priorities in this hospital. In conclusion, this case demonstrates that healthcare is not only measured by clinical knowledge or operational results, but also by the ability to create a safe, respectful, and collaborative work environment. This crisis on the night shift developed because destructive leadership behaviors that were allowed to continue within already stressful situations and poorly supervised environment. Over the time, the nurses developed this kind of fear, emotional exhaustion, and also lack of psychological safety. As a result of that, we got a damaged teamwork, communication, really bad, and also really low and bad patient care quality. However, this crisis also represents an opportunity for positive organizational change by addressing toxic behaviors in an early way, supporting vulnerable staff members, and also implementing transformational leadership strategies. This hospital can rebuild trust and also strengthen its nursing culture. So the full range leadership model provides a really realistic path forward by combining immediate corrective actions with long-term leadership development and also cultural improvement. Ultimately, protecting patient safety, it also means protecting the healthcare professionals responsible from delivering the care every day. Nurses who feel psychologically safe are more likely to communicate effectively and also collaborate with their teams, and also as well to provide high-quality patient care. So this is really important to consider within the environment of work inside of hospitals. With a strong community and also with a strong leadership, accountability, and commitment to the cultural change, Hospital General Región number 17 can overcome the crisis and also work in sustainable spaces and environment for both